United States is not a healthy nation. We are not healthy. Diabetes is skyrocketing. Cancer is skyrocketing. It's like, wow, what is happening? Times have changed. Environment has changed. Our quality of food has changed. The only what's not changed, the body that was developed to thrive in clean environment. We are not created to live in this kind of environment and having so much stress on top of everything. The body is a suit. You have one suit in a lifetime. I'm not gonna get new suit in my lifetime. I have one. So being kind and nice and gentle to the suit I got, my soul got in this lifetime, that's my job to do.
Hello and welcome back to the 5-hour method with Dr. Yuabova. Dr. Yuabova, how are you?
I'm good, thank you. I hope you are as well. We're staying warm in New York. We are beautiful here in Florida. It's beautiful and sunny today. So I just came from work, rushing to get into the studio to join you for this beautiful session. It's always lots of fun.
Yeah. And the weather is getting better day by day. So we're almost there, making to the spring. Yeah. So today's episode is a special one. We have talked about the 5-hour method throughout this series. And we have talked about reveal, remove, replace, restore, and regulate. But today we are going beyond the theory. We are stepping into real stories, real patients, real symptoms, real transformation to understand what healing actually looks like in practice, right? So let's dive into this, Dr. Yoba. So can you walk us through a patient who came to you feeling, let's say, completely stuck, and what were they experiencing when they first arrived? Let's start there, and let's hear you out.
So I have all different kind of patients come with all different presentations. Stuck meaning they tried something or they tried everything and nothing works. And what did we do to make it work? So a very interesting case. I had this beautiful gentleman come in. He's 6'3", 6'4", very tall, very statuesque, with very specific request. He said that he's gaining weight. So when I started asking him questions, and he said that 3 days out of the week, he's absolutely fasting, eating nothing. So he's eating 4 days a week, and he's still gaining weight. So the question was then, okay, what made it now to you? So you came to me because you waited, right? Like it's piling on. And I wouldn't say he was heavy. Yeah, he was stocky, although you see that he's physically active, there is a muscle mass, he has all of that. Yes, he's stocky around midriff area. And I asked him, like, what made the change? And the answer was, I used to go to Mexico for vacation. And every time I would go to Mexico, I would lose weight. This time I went to Mexico and I gained weight. See, that made a change for him. It's like, it's always made me lose weight, but now I have gained weight. On top of everything, I'm constantly gaining weight, and what's going on? So when he came, of course, we did reveal. I spoke to him. His wife came with him. Already during this consultation, we already revealed what was a problem, most likely. We need evidence. We did some blood work. And what we saw, his metabolic state is out of control. He's pre-diabetic, going very close to diabetes. He didn't know anything about it. Think about it. This guy is only eating protein, fasting 3 days a week, and his hemoglobin A1C is 5.8. So he's going toward diabetes, and very quickly, he almost eats nothing, works out, stays active, watches everything he eats. So when we did blood work, and I already told him during consultation, what's I'm not liking. I said, this doesn't look so good, and this is what a sign of. So what we saw in the blood work, his metabolism completely was out of control. The metabolic system has broken. His kidneys, he then was stage 2 kidney disease. So all of this gaining weight, it's fluid that he's retaining along with expanded fat cells. And it presents like he's big. So when we started working, it was very specific. So realigning his system, feeding him instead of making him starve. It's like, you cannot. Your system thinks that you're in constant starvation. And instead of dropping weight, it's going to pile on because it's not sure if tomorrow will be food. We are not in famine here. Your body needs to know that it's safe to live. So started feeding him 4 or 5 times a day, proper combination nutrients, protein, carbohydrate, and fat at every meal. very specifically, gave him supplements, started peptides for his metabolic health. And if I'm not mistaken, he lost 45 pounds in 12 weeks. Eating, not exercising. So what we did, we realigned his metabolic state of being, fed the system, because now system doesn't think that he's starving. It's no longer in starvation. So now system decided, I have so much nutrition. Why hold on to all of this and start dropping all of this? More energy, clear mind, no more brain fog. Men's health, his hormones. I didn't give him testosterone. He increased testosterone twice. In 6 months, we do blood work and we see free testosterone improved twice, like doubled.
Without the therapy.
When I didn't give him testosterone. He's 45 years old. I will not give him testosterone if he still can make it.
Yeah.
There are ways to optimize it. Of course, his liver was fatty and all of those things that show you signs and symptoms of metabolic illness plus inflammation, because that is what fatty liver is about. Your liver cannot undo the damage, cannot clean things out, expands and cells break down. This is very interesting. But again, in order to have these results, everything needed to be done. Support his adrenals. Make sure his thyroid is working properly. His cells are working. ATP production appropriate. So that is how this really done. And of course, he was very challenging. He has very specific condition with very specific presentation. So understanding how the body actually works, we can have these kind of beautiful results.
I have to take a little step back here. So, this is a gentleman who seems to be doing everything right on paper. He's very athletic, looks like it. He's doing fasting. He has this very clear pattern that he notices when diet changes. So it seems to be things were under control, right? But then you discovered his metabolism was a whack, right? So what does that exactly mean? Like, what is this something that he developed more recently, or is it something? How would someone know, right?
So it's probably developed over decades or so. It doesn't develop overnight. It's something that we don't pay attention to. And firstly, we get acquainted to certain signs and symptoms, and we think it's aging. The way we think that progressive aging is losing the function. That's how we trained by media, by everything. Oh, you're not feeling great? That's okay. You're like, 40 some years old. It's okay. You don't have this much energy. It's normal for you because you're whatever. You're not no longer 25. Yes, sometimes it's appropriate. There is some decline. But if you take care of the system appropriately, it should not be a case. It's like when you have a very old car that you're taking care of very well. So if you maintain it properly, you change the oil properly, you take care of the car and put proper gas, it will run nonstop. It will never break. The body is the same way. Unfortunately, the environment is different. So that's a change already. Environment is different. We have lots of toxins. We are changing because of this environment. We no longer can clean so efficiently. So our cells are changing. The function of the system changing. So we have lots of changing. Everything around us changing. So his body is changing too. Because our body is not designed to live in such a changed environment. We are going through lots of alterations and very, very quickly. Think about it again. You have this beautiful car. Yes, maybe it's not a new car. You putting a fuel, and fuel is not pure. It's not clean fuel. What happens to that car? The same thing. We think we're eating organic. We think we're eating foods we can digest. But in reality, the foods we're eating, they actually cause inflammation. And what's going to do to the system? See? It is the same thing. So when I work and speak to men, a lot of times I bring them this example of cars because that's how they understand how that works.
Interestingly, other thing you mentioned is you actually stopped his fasting and that helped in recovery and putting things in. Can you talk about that? Because I feel like there's this big myth. We think that just too fast and it will put things back into track. And that's not true, right? Like there is a lot of things when you recommend you shouldn't be doing fasting. So can you talk about this specific thing here?
So there is not ever one thing that would work for everyone. So everything is very individualized. And yes, if we talk about 40 years ago, you do fasting and you self-repair. Now time, because environment is so different, it's not enough anymore. So yeah, while you're fasting, so think about it. Why do you need to fast to self-repair? So you're no longer causing inflammation to your cells because of the food. You see, you're eating the wrong food. You're not going to be able to recover because that food is constantly being delivered. So now we need to be very precise. Everybody has a different mechanism. So if the food is causing inflammation, fasting will work. But now we're talking about this poor gentleman is fasting 3 days a week and it's still not working. So we know it's beyond that. Now, if somebody says you fast and it's enough, it's wrong, because now we are going through so much changes with inflammation. Just fasting would be enough, because you need to fast, plus you need to repair your liver at the same time, plus you need to support your endocrine function, how your thyroid works, how your adrenal works. So it is more than just that. Just fasting would not work. There's a saying many, many years ago: the best medication would be for somebody who's poor. The best course of action is to fast, because it's cheap and it's always effective. 100 years ago, because when people are poor, they get sick and doctor tells them, you fast. They don't need to pay money for this. They don't need to buy specific food. It used to work. Doesn't work anymore. Times have changed. Environment has changed. Our quality of food has changed. The only what's not changed, the body that was developed to thrive in clean environment. That's how God created us. We are not created to live in this kind of environment and having so much stress on top of everything. I think this COVID era changed a lot for lots of people, because now we see young people and the way they function, it's nothing like we functioned at the age. So if I know your children are very young, if you have somebody who is now 20 and you think about you 20, you've done so much more than they can do at their 20 now. It is so evident. I see it all the time. My patients are now getting younger and younger. They come with very specific complaints. 20 years ago, we only had patients in their early 40s, 50s complaining about. Now they're complaining about these problems in their 20s. It's chronic fatigue. It's always being anxious and somewhat depressed. It's not feeling they're great. They don't understand why they're here. They don't understand the goals. It's like they're lost, so young. So it is very, very specific. That's why in order to get someone to good place, lots of different steps need to be taken into accountability. And in order to get them where they need to be, we need to revamp the entire system. There's no quick fix there. It's simply impossible. You can't do it this way.
This person started losing weight and then without going to Mexico. That's a good thing. So that happened. So that's good. I guess the question here is, once you discovered and you started working on your fixing those things or reversing those things, what did their body actually needed to start rebuilding? Was it like certain things? Can you talk about that, please?
Okay, so I have different kind of patients, different sort of patients coming with different conditions. So I described this gentleman. He is, let's say, overall wellness, right? He had no idea what's wrong. I also have patients that present very specifically with digestive issues, right? When we have patients with digestive issues, we already know entire system is affected. There are also different people that come with symptoms that resemble thyroid insufficiency. Thyroid never works by itself. It's a brain, thyroid, and adrenal glands. Like, it's, again, a system. So in order to help all of these different people, specific steps need to go into place. We need to reveal, understand their physiology and where they are, and understanding how their symptoms, now they have symptoms, right? But the symptoms always have a root cause. How this root cause of their symptoms caused a change in their metabolic state and their health altogether. We need to understand cardiovascular system. Is it affected? What about the mitochondrial health? Is it affected? What about their liver? Is liver working or liver is not working? Maybe it's all of this, because the liver is also affected, like everything. And only then a program gets created for them to address every little part, every system of the body, but in a very specific way. Let me explain this way. We're talking about hierarchy. For example, if I have a man or a woman that came to me with no matter what complaints they have, and when I see their blood work, I see that their system is so affected, that's the first organ that's affected negatively, and it's alarming, it's always cardiovascular system. Because if their cardiovascular system is already so affected, if you don't do something quick, they will have cardiac event. They might have heart attack or stroke. People not realizing nobody has heart attack or stroke out of blue. It doesn't happen like this. There are always predisposing conditions that cause them to have these, especially if men are in their mid-40s, early 50s. You know that the high risk is very high, and we spoke about it already. Risk is so high, and we need to reduce that risk very quickly. Anti-inflammatory, everything. Anti-inflammatory to them. what will reduce inflammation for them, the food that reduce inflammation for them, the supplements that will reduce their inflammation. For somebody, it's anti-inflammatory. For somebody, it's very pro-inflammatory. So the protocol's extremely precise. And they're very different for each patient. That's why understanding this individual, this is what's necessary in the beginning. The individual, what do they need? Precision of care is important. I have patients that come to optimize their fertility. Men and women, we need to understand what's happened and why their fertility now is secondary, sometimes it's tertiary to the system. Why body decided that? What happened? Do they have enough nutrition? Usually, if people have enough nutrition, fertility is always preserved. So if body decided, fertility is on the side, question is why? What caused it? If you're deficient, or maybe you're toxic, maybe your hormones out of the loop, maybe, you're so deficient you're not understanding. For women a lot, over exercising. The energy expenditure, what are you spending your energy to? I also have seen I have women that very high end parasitic infestation. You have too many parasites, your body can take only that much. Don't be surprised. Your body will choose either you with your parasites or the baby. So if body cannot figure out the parasites and cannot get rid of parasites, the ones that can get rid of, it's the fetus, and we'll get rid of the fetus. We need to understand how body works and how body functions and prioritizes well-being. I think last time we spoke about it and I said if you take somebody outside and it's really cold, the arms and legs will get cold where the temperature will be held at the core because we have organs that our life depends on. So this is very specific. So I never met a person that understands the physiology the way I understand it. That's why I'm speaking about it so people can learn. It's not, it's not separated system. It's one system. It's one whole system. And once you understand the whole system, how it works, then you can create these beautiful results. And results are everlasting if you're maintaining them. That's what makes the biggest difference. So we spoke about wellness. We spoke about fertility. Male fertility, the same thing. So when we're talking about fertility, it's not just female, it's also male. So if we want to optimize the system, we want to make sure body chooses fertility over anything else, right? So it should be clean, it should be fed. We need to also pay attention and quality of egg and a sperm. The quality. If you want a healthy baby, the quality should be superb, should be great. If you don't have a grade of the quality of your biological material, what do you expect to get, right? When we're buying a dog, if you have the funds, you go to the breeder. You don't go to the pound. Not many people go to rescue a puppy, which should be a right thing to do first. Go rescue a puppy because this puppy needs a house or this dog needs a house. People that want to invest in something, they need to understand what they're investing in. And you want to invest, you invest your time, your effort to improve your health so that your cells are healthier so you can create an offspring, the best of the best that you can have because you're going to have this child for the rest of your life. It's not going anywhere. So life expectancy of a puppy, what? 12, 13, 15 years? Life expectancy of a human? A lifelong, right? So people need to understand and prioritize and also understand the value of this. And even if somebody coming for fertility, I always tell them there is no way we can change your fertility without addressing your body. It's one system. So when patients go to see an IVF specialist, I get it. It's sometimes necessary for specific reasons. It could be different reasons. But this base work needs to be done first. We need to address their fertility through their well-being because your reproductive system is not a separate system. It's one system. And it's always at the end. It's not on top. It's not here, right? We don't have reproductive organ in our brain. They are at the bottom. Yes, signaling coming from here, but then ovaries, uterus, penis, and testicles are at the bottom of our body. So reproduction, if it's not chosen, will be first one to go by the body. It simply turns off. It's like you have turn on, turn off mechanism, on and off, on and off. So what body decides to do it or not to do it.
One thing is that obviously this is very complex, right? Like when you think about this, like there is multiple things to find the right root cause and some things need to move, before the other can be moved. But it's clear that you are able to paint this picture that there is a sequence of things that needs to happen. So I think that one of the bigger takeaways or the learnings from this podcast is to understand that there's a sequential playbook to this. Like you have to follow these things in this manner. The question here is, do you start seeing the shift, right? Like, is it like the reversal or the improvements? Do you start seeing it as you are going through these different line items sequentially, or you have to go a whole bunch of them as a group and then you start to, how does it work on the patient side?
We see results very quickly. So usually what people respond to, the digestive system works much better. So as soon as you reduce inflammation through the food,
Yeah.
it's just a given. So stop eating something that causes inflammation. Patient tell me, "Oh, I follow anti-inflammatory diet." Who said? Said who? That what you're eating reduces inflammation. Who said that? Oh, I'm following somebody on TikTok, Instagram Plus. I checked it on Google, and Google plus ChatGPT agreed. Did ChatGPT knows you? Does it know your physiology? Does it understand how your system is working? It's very specific, but we usually hear out of patients very quickly. Few weeks, sometimes 2 weeks, sometimes 3 weeks, very quickly. What they say, oh, I'm not so bloated anymore. Oh, I'm not burping anymore. And trust me, when system is not working, digestion is always, because if your digestive system is optimal, you don't know they have any problems. Because we're getting our nutrition through digestive system, absorption. No matter what you ate, if your stomach is a little bit inflamed, you're not getting nutrition out of absorption. You're not absorbing anything. So you're basically eating and then you're wasting into the bathroom. So I ask my patients very specific questions starting from the moment they wake up. Like, let's go through the day. You open your eyes. How do you feel? What kind of thoughts come to your head? Are you excited and out and about to hop off? Or you kind of, want to lay in there for another half an hour, 40 minutes before you can actually get off the bed? Okay? What do you do after that? How do you feel? What do you feel like you want to eat? After you ate, how do you feel? If you do physical activity, how do you feel after physical activity? I have a lot of athletes, and with athletes, what I see, it's very specific because their mindset is so proactive, which is beautiful. They are trained not to hear what their body is saying. It's all about performance. No matter how I feel, I gotta do A, B, C, D, and F because this is just what I do and how I do it. And exercise is good for you. I'm not saying exercise is bad for anybody. It's great when you have resources to spend to exercise, the energy. If you don't have the resources, don't spend it to exercise, spend it for healing, right? For example, you have $100 in your wallet. To make it easier, you have $100 in your wallet and you're thinking, okay, I only have $100. What am I going to do with this? I can go watch a movie with my daughter or I can go buy some food. Well, the choice would be for body, always go get some food because this is hierarchy of needs. It's a physiological needs of your system. Don't go and watch a movie or don't go online to sign for karate class. Don't do this because you need to eat. Because if you don't eat, then your body will struggle, right? So system does the same thing, but then body follows what our choice is. If I decide to go and exercise, body cannot just shut down. It goes along with it because we decide. Body does not decide. And why is it happening? Because we don't listen to our system, to the body that we have. We forgot that we need to listen. We know that we learned and been trained to do whatever we did, not understanding we need to listen to ourselves. So when I work with my patients, I teach them. I was like, forget about everything else. Start listening to yourself. If you really don't feel like exercising, maybe there's a system telling you maybe you shouldn't be exercising. If somebody tells me, oh, but exercise is good for you and all of that, I agree. It's good for you when you have energy. If you go for exercise and you are recovering for 3 more days after this exercise, you're exhausted. Why? Your body definitely doesn't have energy for this, right? If I also had this very interesting example, this beautiful male patient came with genetic condition. I'm not going to say which one. And the symptom is cramping, very severe cramping, not able to sleep, takes days off of work because of this cramping. So when we started working and I told this individual, I do not want you sweating. You understand? You can go and be active. Do not sweat. Why can't I sweat? Explanation, you're cramping because you don't have proper electrolyte balance in your system, and that's why you're cramping. I worked with this guy for a year and a half. For 6 months, he stopped cramping completely. This is genetic condition. We changed his electrolyte balance. I taught him how to not overspend what he has in his system, and all of this stopped. He was able to exercise. He built muscle, which he was, with his diagnosis, almost no muscle. So this, we always can adjust the system according to no matter what they have. But the adjustments have to take place and they should be done accordingly. So for nutritional deficits, we have to overcome the deficits. We're understanding that, the food we're eating no longer will provide. So that's the supplementation where it comes into place. So with my patients, we do IV nutritional therapy, we do diet, we do supplements, and we do peptides. We do everything that's available on the market. I do not do stem cells. That's what I do not do. But all the other modalities I use, and I use them very well to, successful healing of this individual. And yeah, we see beautiful results.
I have a question about this listening to body, right? So a part of it is bad habits. That's why we are in this situation, right? Like either bad habits of eating, exercising, whatever, right? Now at the same time, if you tell us like also listen to your body, I don't know, it's hard to make a decision. Is it still I'm getting trapped into bad habits or is it really the body telling you? What's your advice there for the people to
So
just
the advice take hire somebody who understands your system. Hire someone instead of guessing, so that someone can guide you through and train you how you can regain this knowledge and communication with your own system. It's your system. The body is a suit. And I think I said it before. You have one suit in a lifetime. Yes, we can, make some adjustments to the suit, but it's still one suit. I'm not going to get new suit in my lifetime. I have one, right? So being kind and nice and gentle to the suit I got, my soul got in this lifetime, that's my job to do. So when we come into this world, the most important lesson is prioritize self. So we need to reconnect with ourselves. If somebody is very confused and simply was trained certain way and educated, do this, not do this, and because we all go through this and they don't know how to, they need to hire somebody who will help them to understand their system. Firstly, again, reveal. This is what we have on the table. Like this, and this needs help. This and this is not working. How can we do this? Have a plan of action. So basically, it's like a Google Maps with point 8 with stops. This is how we're going to do this. We're going to do this, and this. And that's what needs to happen for us to do this and be successful. Do you want to hop on the bus and we do it together? Or you can figure it out by yourself. Not a problem. And people understand. So now they actually have a path. They understand the value because now you are in a place where somebody really understands you, understands what you need, and will guide you through entire process. You just have to make a choice. A lots of times I don't take these people who are not sure. And I say, I do not take people on not sure people. Because if I want good results, I want to have sure people, not non-sure people. So because what makes me, what drives me, the results. This is not instant gratification. I have to wait for this result too until it happens, right? So in order for me to feel good, I have to receive the result. So why do it if there's no result?
again, you have also mentioned in previous conversations that everybody will have, there's no like perfection there, right? Everybody's imperfect in that way, right? And so you also help them build that within the program, that imperfection, like guided imperfection, I like to call it. So is that something like, how do you tell, of course, once you think that people are good enough to stick with the program and they're good.
They stick. So what I see, it's actually people that want to overachieve. It's like, oh, I'm not going to cheat. It's like, you got to cheat because it's my order to cheat. Once a week, you're going to cheat. You're going to make a choice of what you're going to cheat with. The amount of whatever you want to eat, it's your choice. But you need to allow this for yourself to do something that you really love. So I'm not caging them. I'm giving this freedom to choose and to learn. You see, you're going to eat whatever that you want. What do you like to eat? Oh, ice cream sometimes. I was like, so eat some ice cream. But be careful. Amount of that ice cream you will eat will impact how you're going to feel next day or maybe two. So why do I do this? This is a method of teaching and learning. So you understand how much of that your body can take. Okay. And again, I'm not trying to create a sterile environment. I'm trying to allow the system, give a space to the system to repair. And still, you're introducing the system, so the system is not completely shocked when that item is reintroduced. So when we go through 6 months program, I start introducing things already. I was like, this is what we're going to do. Now, you've done great. We made a lots of repair. Now we're going to see what the threshold is. So you can cheat. Instead of 1 day cheating, you cheat 3 days. Pay attention how much you can cheat and what your body does. So if you cheated and you have very funny reaction, next 3-4 days, you clean until all of this is gone. Again, learning, right? It's active learning, and they are learning. And they know, it's like, oh, wow, now I can eat all of that. I never was able to eat this before. Wow, my body is just great. I'm not bloated. I'm not burping. I'm not gaining weight. It's all good. Now let's see at some other things and see how your body does. So finding this threshold, where is it? Some people simply can eat whatever they want after that. Some people twice a week, they have to be clean. It's like we need to understand where is this perfect, situation where they can do whatever they want and how to keep system as optimum as possible at the same time. See? If everybody accumulates that knowledge, the knowledge is right there. I give it to them, yeah, you have it. Then their choice is to keep system as optimum as possible by making proper choices for them. You see, I give them this, here, take it, no problem. You go through this program, we teach you a lot, you're learning a lot. So I have a very interesting case right now. This beautiful girl, very young, she's in her mid-20s, had thyroidectomy. So the thyroid is cut out for the reason. And she wanted to optimize her fertility, but even to go through fertility, I said, you want fertility, your biggest problem here that you have no thyroid. She's like, well, I'm on hormonal replacement therapy, I'm taking medications. Like, I get it, but you have specific symptoms that indicate to me that your thyroid is not optimum. So the hormone you're taking is not proper level. Let's go through so we can understand what actually proper levels look like and how does it feel like. So this girl is very diligent. She's always notebook, takes notes, beautiful. And I started teaching her. Firstly, we need to see what pulse is like, pulse rate, the body temperature, how she feels. So first adjustment I made, first, I changed the ratio of different hormones that she's taking for thyroid. Because thyroid is not there anymore, you know? The way thyroid works, it's communication with the brain. We spoke about it before. So if thyroid is not there, the brain cannot signal to thyroid to release certain hormones in certain sequence, right? So now, basically, instead of the thyroid, it's a doctor that prescribed one dose. But let me explain to you, the female body flip-flops on hormones all the time. When we are cold, when we are hot, when we are before menstruation, during menstruation, after menstruation, different hormones are required. Before ovulation, different hormones, like different levels are required to after ovulation, when implantation, like it's so vast. And first thing she said, she's like, you know what? I feel I'm no longer foggy in my brain. I can have this conversation and I don't have to stop to think for a minute. You see, before she said she had no problems. Now, I only did it first time and then she's like, wow, this is different now. So I meet with her quite often and I ask her, give me your numbers. I prefer to do deep tendon reflexes if she would be next to me. So do it by reflexes. You also can do it. But she's not next to me. She's in a different state. And that's how I guide her. And every time she gives me a report, I am in Tennessee in my home. This is how my reading looks like. I'm in Dominican Republic. I was like, you cannot compare two. Dominican Republic is hot. Tennessee is cold. We cannot do this. So each state, because our thyroid, the way it works, it reacts almost to everything. If somebody makes her upset, her levels will drop too. If she eats more protein, the levels will change too. You see, it's making a lot of shifts and I'm teaching her how to do it. I gave her very specific small doses of active hormone where she can add or subtract if it's necessary. You are in colder environment, add a little bit. You're on heat, take a little bit off. Like this knowledge is for the rest of her life because she's never going to have thyroid. She's never going to have thyroid. It's never going to come back. And we cannot revive it. It's not going to grow. Okay? It's finished. It's non-existent for her.
This is such a beautiful way of everybody is unique, yes. But I think not our traditional medicine isn't like individualized healing. This is what you have personalized to everything here. Like this is what personalized medicine with what looks like with precision. Like that's what you explained here. And I think that it's just such a hard thing even for people to have that awareness. We are just like very little aware. We're just barely scratching the surface. I would say that. And I run this media network. I know, I know what we talk about. And we haven't reached to that level of nuanced knowledge in just people to even understand that this is really how precision medicine with your personalized medicine and why that matters. How these small things that the examples you just gave, temperature change, how body reacts to this. This is why your dosage should change. This is not actually done. Up until to this point, I would say like at least for my generation, I would speak that very clearly. Like it has been always just like one medicine, take it, go
You can't. You can't.
That's what the state is, right?
It's not appropriate, it's not correct. Everybody is different and everybody needs very specific approach. So if somebody really values themselves for that approach, that's what they should look for. You know, you got to look for that very specific approach because that's what's going to give you what you're looking for. If somebody is looking for something generic, give me a Band-Aid. This definitely is not for you because Band-Aid never going to last. Don't forget, you put the Band-Aid on, your arm, whatever you put, it got a little wet and Band-Aid fell off. He's like, you don't take medication, the problem is right back. So this is very different. This is different medicine. It's absolutely beautiful. I love what I do and it's actually lots of fun.
Yeah. And I was going to ask you this on your personal level, right? Like you said, and I explained you of how just general population thinks about it. What did you think, like, where do you see the future? Like now, moving forward now, are you more optimistic or is it more like, we're still going to get trapped into this in general of just specifically to what you do, meaning personalized medicine, precision medicine? Where do you see this is heading? Is it moving in the right direction?
I think that's the only way to do because what everything is changing so fast. And if we don't change into personalized medicine, we're going to have a lot more influx in chronic diseases because United States is not a healthy nation. We are not healthy. As a nation, we're not healthy. Diabetes is skyrocketing. Cancer is skyrocketing. It's like, wow, what is happening? So if we don't learn this very quickly and we don't learn how to help big masses of people, doesn't look pretty. So the only way to do is to personalize the medicine. I'm very optimistic because people need to learn it. No matter who is doing or offering personalized care needs to learn how to do this right and then do it as such to give these people a beautiful future.
I love that. I think definitely we need to move in this direction. I think there's no better way to do it just because human body is so different one from another. It's not just like one thing for everyone, right? And our lifestyles are so different, our foods are different and everything is different, right? So it is no brainer to think like that it is. But at the end of the day, it's just like how we have done medicine in the country. It just feels like it's so off from what you were talking about here.
I'm looking at everything as an opportunity. I think it's opportunity now to make a great shift. I don't look at it at the deficit. I'm looking at the opportunity. So opportunity is there. People just have to make a choice. Firstly, consumers should make a choice what kind of medicine they want. And then we should make a choice in education, how to educate providers and how providers should be providing care. So it's a great opportunity. I'm very positive, all about, how can we make things better?
Yeah. Is Dr. Yoba has a plan to also help other clinicians get better and move toward this direction?
So I'm actually working on a course I want to put together and teach people to do what I do. Of course, what I do, this came with years of practice. And in order for somebody to get there, spending years that they don't have to spend. But when I'll be able to put it all together and present it to people, it will open their mindset to understanding things the way I understand them, more or less. So they could be so much better than what they are right now. I'm not saying they're going to do exactly how I do it. Probably not, because I'm just ahead because I started some time ago and I've done it for such a long time and I have my own understanding. But instead of for them starting from 0 to 10, right? We say from 0, if they can start after the course through like 0.5 instead of 0, so push them forward, it's already great. It's already, it would propel them so much forward. And then their experience will take them so much faster forward. So they understand how all of this really works.
I mean, I definitely got clarity of how you explain. You have almost like I can see it when you're talking. You're like painting a picture. Like I can literally see like how it's going, and that's the beauty of it, right? Like you have that skill set. So, and it's obviously works for patient. I'm sure it will work for clinicians too, to the level how if you teach it. So I really hope that comes out so from your end, so we could get more out of this. But yeah, this has been great once again. Lots of great points made. And I believe that I am moving towards more and more towards this exactly personalized medicine. I'm a big promoter of that as throughout when I'm learning more as well. And I really think that this is the way it is. So once again, thanks for sharing your insight. This has been great. And for our listeners, again, every symptom has a story. And as we heard today, when you take time to understand that story, the body is incredible. It has incredible ability to heal, but you need guidance. You're just not going to do it like how I asked that question. It's you will not know exactly how it is. So if you are ready to understand what your body might be trying to tell you, reach out to Dr. Yova on her website or at her office. The website is nationalwellnessgroup.com and her office is in Boca Raton. So reach out to her directly. And thanks again for joining us. Thank you, Dr. Yova, once again for this
Thank you
insight.
very much, Vivek.